incredibly difficult weekend for many people across Nova Scotia. To everyone who lost someone and to the entire community, know that Canadians are holding you in our hearts. Aujourd'hui, je vais vous parler des mesures de santé publique, des vaccins et du soutien offert aux Canadiens. Commençons d'abord avec la santé publique. Canada continues to face an incredibly serious situation with this third wave. Cases are rising rapidly. In many cases, in many places, numbers are higher than they've ever been before, and far too many hospitals are stretched way too thin. In Toronto in particular, numbers are breaking record after record, and ICU hospital beds are filling up. There's no doubt that Canada's largest city is struggling under the weight of this third wave, so we're going to do whatever it takes to help. On vaccination in particular, Ontario has reached out for more support. I can tell you today that we are standing by to deploy the Canadian Red Cross to help with their mobile vaccination teams. This is about getting doses to people where the situation is most serious. And we'll also continue to help on a whole range of other fronts, too. Discussions are ongoing about extra healthcare providers, and we are ready to step up. We've also already deployed mobile health units that set up more hospital beds in Toronto and Hamilton. For Ontario, we've shipped out more healthcare equipment like oxygen units and drugs to treat COVID-19. We have approved a request to have the Canadian Red Cross deployed in up to 27 long-term care homes as needed. We're supporting safe isolation sites everywhere from Toronto to Peel to Thunder Bay. And we have deployed 300 contact tracers doing thousands of calls a day for Ontario, and lab support, which has already processed over 15,000 samples so far. Yesterday, I spoke with Mayor Crombie of Mississauga, Mayor Tory of Toronto, and Mayor Brown of Brampton. We talked about what's going on in the GTA and what that means for hospitals, schools, and small businesses. We also talked about the fact that this is a moment when we all have to work together to flatten the curve while getting vaccines into arms as quickly as possible. Earlier this morning, I also spoke with Mayor Scarpitti of Markham. I told him what I told the other mayors last night, that our government is here to help. And that's true for every community in Canada. No matter where you live, know that we have your back. We're supporting COVID-19 testing for people in BC, Alberta, and Manitoba through mobile labs that can reach more patients. We're providing help on isolation sites in places like Nova Scotia and Saskatchewan to stop cases spreading. And across the country, we've stepped up with money for school safety, shipped out PPE, and of course, delivered vaccines. The frontline workers, people working in hospitals, those they're caring for, and their families, know that we have your backs, even as you have ours. You've been heroes throughout this pandemic, stepping forward to help all Canadians. We recognize that. We continue to be there for you. You don't have to face this alone. We will support you and your families as you keep us all safe. Thank you for what you're doing. And to all Canadians, I know you're exhausted. I know you're all sick and tired of COVID-19. I know nobody wants to be in this third wave. Nobody wants to be facing further restrictions. We just want to be done with this. But we know how to do what we need to do. We need to follow the public health rules. We need to hang in there and hunker down for a number of more weeks. Nobody wants to do this. I got in an argument with my 13-year-old this morning who doesn't want to do this. Nobody wants to do this. But we know that if we hang in there, hunker down, and follow the rules for the coming weeks, as much as we're tired of them, as much as we're frustrated, we have a chance of getting to the summer in much better shape. This is a moment for us to dig deep at what is hopefully the very late stages of this pandemic for us all and make it through. It's time to show our neighbors and our loved ones what we're all made of as we keep people safe. La semaine passée, j'ai répété au
Last
Premier
week,
ministre
I
de provinces
repeated
et
to the
territoires qu'on est
premiers of
prêt à
provinces
leur
and
offrir
territories that
tout
we are
le
ready to
soutien
offer them
nécessaire.
all the necessary
On
support.
traverse
We are currently
actuellement
going
une
through a
période
very
très
serious
grave de
period
cette
in this
crise.
crisis.
C'est important qu'on
It is
continue de
important
travailler
that we
en
all
équipe,
continue to work
parce
as a team.
qu'ensemble, on va
Together,
passer
we
à
will
travers.
get through this.
On vaccines, while we, like many other countries, have been impacted by manufacturing challenges at Moderna's European facility, this morning I have some very good news to share about Pfizer. Canada has now signed an agreement with Pfizer for 8 million more doses of the vaccine. This is on top of what we have already purchased. I want to thank everyone at Pfizer for their cooperation and hard work, not just to keep deliveries on schedule, but to move more doses up and reach new agreements. With the new deal, Canada will receive 4 million additional Pfizer doses in May, another 2 million in June, and 2 million more in July. For next month alone, this will come out to about double the Pfizer doses we were originally expecting. All told, we'll be receiving 8 million doses in May and almost 12 million in June from Pfizer alone. Now that's a lot of numbers, so here's the bottom line. More doses arriving sooner means more people getting their vaccines faster. And that means more people who are safer and more families that can breathe a sigh of relief. Le Canada a maintenant conclu une entente avec
Canada has now
Pfizer
reached
pour
an agreement
obtenir
with
8
Pfizer
millions de
for an
doses
additional 8 million
supplémentaires
doses
qui s'ajoutent à
on
celles
top
que nous
of
avions
what we have
déjà
already
achetées.
purchased.
Grâce à cette
As
entente,
a result
on
of
va
this
recevoir
agreement,
4
we will
millions de
receive
doses
4 million
supplémentaires
additional
au mois de
doses
mai,
in May,
2 millions de
2
doses
million additional
supplémentaires en
doses
juin
in
et
June,
2 millions de
and
doses
2 million additional
supplémentaires
doses
en
in
juillet.
July.
En résumé,
In short,
ça veut dire qu'on va
this
recevoir
means that we will
environ 2
receive
fois plus
about
de
twice
doses
as
de
many
vaccin
doses of
Pfizer que
Pfizer's
prévu
vaccine
pour le
as
mois de mai
planned for
et
May,
des millions
and
de
millions
plus
more in
en juin.
June.
On travaille
We are
sans
working
relâche
hard
pour que chaque
to
Canadien
get
puisse
every
se faire
Canadian
vacciner
vaccinated
le plus tôt
as soon as
possible.
possible.
Je sais que bien des gens,
I know that
particulièrement
many
des jeunes,
people, especially young
attendent
people,
patiemment leur
are
tour
waiting
pour que leurs
patiently so that their
grands-parents, leurs
grandparents,
parents et les
parents,
travailleurs
and
de
frontline
première ligne
workers can
puissent se
get
faire
their
vacciner
vaccine
en
first.
premier. Merci
Thank you,
et tenez-vous.
and hang in
Vous
there.
allez recevoir vos
You will
doses
get your dose
bientôt.
soon.
On est en bonne
We
voie
are
pour
on
vacciner
track to
complètement
fully
tous ceux
vaccinate
qui le
everyone who
souhaitent
wants it
d'ici la fin
by the end
septembre.
of September.
Je sais que ce
I know
printemps a
this
été
spring is
difficile,
tough,
mais l'été
but
et
the
l'automne
summer and
seront
autumn
meilleurs
will be
si on
better
tient bon
if we stick to
et
our
surtout
guns and
si
follow
on suit
public
les règles
health
de la
rules.
santé publique. Remember that this won't last forever. There's every reason to believe that we're now in the final, although toughest, stretch of this pandemic. This is not the moment to let up, not even for a second. So no matter where you live, keep your distance, wear a mask, stay home whenever possible, wash your hands, download and use the COVID Alert app, and be sure to follow local public health guidelines. Hang in there a little longer because we're going to get through this. C'est tout à fait normal de ressentir de
It is
l'anxiété
perfectly
ou
normal
du
to
stress
feel
en ce moment.
anxious or stressed at the
Vous n'êtes
moment.
pas seul.
You are not
Votre
alone.
santé mentale est
Your mental
importante
health is
et il y a des
important,
gens
and
qui
there
peuvent
are
vous
people
aider.
who can help you.
Si vous éprouvez des
If
difficultés,
you are experiencing
n'hésitez pas
difficulties,
à
do not
demander de
hesitate
l'aide.
to ask for help.
Il y a un an, on a lancé
year
le
ago,
portail en ligne Espace
The online
Mieux-être
portal
Canada.
Wellness Space Canada
Le
was
site web
launched.
offre un soutien
This website
gratuit
offers
et
free and
confidentiel en
confidential
matière
mental
de santé
health
mentale et de
and
consommation de
substance
substances
use support
24
24
heures
hours
sur
a day,
24, 7
7
jours
days
sur
a
7.
week.
En un an,
In one
plus de
year,
1,2
more than
million de
1.2
personnes
million
d'un bout à
people
l'autre du
across
pays
the
ont
country have
utilisé
used this
cette
resource.
ressource. Il n'y a pas de honte à
There
avoir
is no
besoin
shame
de
in needing
parler
to
à
talk to
quelqu'un
someone
ou de
or
demander
in
de l'aide.
asking for help.
Alors que vous
So,
soyez à la recherche
whether
de
you're looking
conseils,
for
de
advice,
ressources, de
resources,
renseignements fiables,
reliable
ou d'un
information,
soutien
or
immédiat,
immediate support,
vous pouvez
you can
toujours vous rendre
always
sur le site
go
de
to
l'Espace
the
Mieux-être
Wellness Space
Canada pour
website for
trouver de
help.
l'aide. Whether on vaccines, healthcare resources, or mental health support, We're focused on what you and your family need to get through this crisis. On that note, this Monday, we will be releasing our 2021 federal budget. In the last few days, I've had meetings with all of the party leaders to discuss that budget. As I said to each of them, it's vital that we work together right now. This is especially true on measures that are about helping you get through this pandemic, whether you're a parent, a student, a small business owner, or a senior. On aura plus de renseignements à vous fournir lundi
We will
prochain
have more to
au
tell
sujet
you
du
next
plan qu'on
Monday
met en
about the
œuvre
plan we
pour
are
assurer la
implementing
sécurité
to
des
keep
Canadiens,
Canadians
créer
safe,
des emplois pour la
to
classe
create jobs
moyenne
for the middle
et
class,
rebâtir une
and to
économie
rebuild a
propre
clean,
et
resilient
résiliente.
economy.
Et pour l'instant,
But for
je
now,
peux simplement vous
I'll
dire
just say
ceci.
this.
L'ensemble
All
des
of the
mesures
measures in
prévues dans
Budget
ce budget ont
2021
pour but
are
principal
focused
de
on
vous aider
helping
à
you through
traverser
this
cette crise
crisis
et
and
de rebâtir un
rebuilding a
Canada
stronger
plus
Canada
fort pour
for
tous.
everyone.
Finally, I just spoke with Her Majesty the Queen to extend my deepest condolences and the condolences of all Canadians on the passing of His Royal Highness the Duke of Edinburgh. She expressed to me how touched she was by the tributes that have been flowing in from Canada and around the world for Prince Philip. And she highlighted and remembered for me all the fond memories she holds of trips to Canada with him over the past many decades. Prince Philip's legacy of service will be long remembered here in Canada, especially in his work to empower young people. Merci tout le monde. Thank you. I'll pass it now to Minister Anand. Anita.
Thank you, Prime Minister. Good morning, and thank you all for joining us today. I will take just a few moments to expand on the additional Pfizer deliveries that are coming to Canada in May and June, as well as provide some other vaccine updates and how they fit into the overall vaccination campaign. À ce jour, plus de 12 millions de
So
doses
far,
ont
more than
été
12 million
livrées au
doses
Canada
have been
et nous
delivered
collaborons
to
activement
Canada, and we are
avec nos
working
fournisseurs
diligently
pour
with our
accélérer
suppliers to
et
further
renforcer
accelerate and
les
supplement
calendriers de
our
livraison.
delivery schedules.
Ce travail
And
porte
that work is
fruit.
paying off.
Par exemple,
For
au
example,
départ, nous
we were
devions
originally
recevoir
planned to
6
receive
millions de
6 million
doses de
doses of
vaccins avant
vaccines before the
le
end
fin
of
de
March.
mars. Nous avons
We exceeded
dépassé cet
this target
objectif de
by
3,5
3.5
millions
million
de doses
doses
et en avons
and reached
reçu
9.5
millions.
million.
As the Prime Minister has just announced as well, this week we have secured an additional 8 million Pfizer vaccine doses under our agreement. The first 4 million additional doses are scheduled to arrive in May, followed by 2 million doses in June and 2 million more doses in July. In addition to this, Pfizer is also moving another 400,000 doses from the third quarter into the month of June. Thus, the delivery schedule for both May and June will see approximately 2 million doses of Pfizer coming into the country every week, and indeed in June, that amount will be more. There will be 12 million doses spread over the 5 weeks in June. The total is going to be 24 million doses between April and June from Pfizer alone. That is excellent news. C'est une excellente nouvelle pour la
This is
population
tremendous news for
canadienne.
Canadians.
Cela veut dire
It
que nous
means
allons recevoir
more
plus
Pfizer
tôt plus de
vaccine
doses de
doses
vaccins
will
de
arrive
Pfizer
sooner
et
on top
ce en plus des
of the
millions de
millions
doses
of
des
other
autres
vaccines
vaccins
we
que
already
nous
have coming.
attendons déjà. Comme je l'ai
As
souvent
I have
indiqué au
repeated
sujet de
often,
l'équipement de protection
including
individuelle
with
et aujourd'hui
PPE
des vaccins,
and now
le
vaccines,
marché
the global
mondial
market
demeure
remains
très
highly
compétitif et
competitive and
volatile.
volatile.
In this vein, as Moderna indicated this morning, it faces ongoing challenges with ramping up production to meet intense global demand due to labor shortages and other issues. As a result, our next shipment will be smaller than expected, and we may see additional delays over the coming months as Moderna's production capacity continues to increase. This news is obviously very disappointing. Our government will, however, continue to bring vaccines into the country in the face of volatile supply chains. Remember, that a year ago, vaccines didn't exist for COVID-19. Supply chains and manufacturing systems did not exist either. We will continue to press Moderna and all of our other suppliers to do everything possible to respect their delivery targets and to provide more consistent delivery schedules. I can now also provide an update on anticipated deliveries of Johnson & Johnson's vaccine and AstraZeneca. Canada will receive an initial shipment of approximately 300,000 doses during the week of April 27th to be delivered to the provinces at the beginning of May, with more substantial deliveries coming in the latter part of this quarter and into the summer. For AstraZeneca, Canada is still expected to receive 4.1 million doses from all sources by the end of June, with further deliveries in the third quarter. Indeed, I spoke with AstraZeneca executives this morning and am pressing for more AstraZeneca doses to Canada in the coming weeks and months ahead. In total, Canada will receive between 48 to 50 million doses of vaccine by the end of June. Despite the temporary and short-term fluctuations in deliveries from our suppliers, Canada's vaccination campaign overall is gaining ground. We are currently ranked 4th among G20 countries for doses administered per capita, and 2nd in the G20 when it comes to the average number of doses administered daily per capita. Cela dit, ne vous
Make
m'imprenez
no
pas.
mistake,
Malgré
however,
tout ce
despite
progrès,
this
il
great
reste encore
progress,
beaucoup de travail à
there
faire.
remains much
Et
more
notre
work yet to
gouvernement
do,
entend
and
bien
our
veiller
government will
à ce
continue
qu'il
to
soit
ensure
fait.
that this work
Les
is done.
prochains mois seront
These next few
déterminants.
months are
Tous les
crucial.
Canadiens et
All
Canadiennes doivent
Canadians
faire
must
leur
do their
part
part
et
and
continuer de
remain
suivre
steadfast in
rigoureusement
following the
les consignes de la
guidance
santé publique
of our
pendant que
public
la
health officials
vaccination
whilst
suit son
inoculations
cours
roll out
dans tout
across
le
the
pays.
country.
Our government will do its part by continuing to support Canadians in our time of need. And I can tell you that my team and I will do whatever it takes to ensure that an accelerated flow of vaccines will keep coming into this country. At the end of the day, I'm a mom with a spouse and 4 kids and 3 dogs. I feel the urgency, like everyone else, to get vaccines to Canada as soon as possible. Every day, my team and I are ensuring that our delivery of vaccines increases for the benefit of all Canadians. Merci beaucoup. Thank you. Miigwech. Dr. Tam?
Bonjour. Bonjour. Hello. Good afternoon and bonjour à toutes et à tous. So to date, over 1,096,000 cases of COVID-19, including 23,500 deaths have been reported in Canada. Over the past week, there have been an average of over 8,600 new cases reported daily. During the same time, the number of people experiencing severe and critical illness continues to rise. On average, over 3,400 people with COVID-19 were being treated in our hospitals each day, including almost 1,500 people being treated in intensive care units, representing a 34% and a 22% increase, respectively, compared to the prior week. Unfortunately, we're now beginning to see an increase in the mortality trend, with an average of 41 deaths reported daily over the past week, which is a 38% higher than the week prior. There are over 51,600 variants of concern cases reported to date across Canada, with the B117 variant accounting for almost 96% of these. On this final or last stretch through this crisis, we can also gain strength from good news and focusing on the things we're grateful for. We have been heartened by the many ways Canadians are helping to support COVID-19 vaccination efforts. Since April is the Sikh Heritage Month, we'd like to highlight an example we recently learned about from that community. Sukhmeet Sacha, a UBC, University of British Columbia, medical student, has been working together with a Sikh Health Foundation and a team of volunteers to translate and share information about COVID-19 with Punjabi-speaking seniors in the Fraser Health region. Their efforts are helping to support community members to make an informed decision on vaccination and at the same time dispelling misinformation. This week, we were also grateful to be among the over 7 million people in Canada who have received a first dose of COVID-19 vaccine to date. And the good news is that vaccines are reducing severe illness, deaths, and outbreaks in high-risk settings and populations that were targeted in our initial phase of vaccinations. So we all need to keep following public health advice and maintaining our well-practiced precautions as vaccines roll out further. These benefits are building, and they will be the bridge that takes us all to greater safety and back to the things we have missed so much. Thank you.
Bonjour à toutes et à tous. À ce jour, plus de 1
morning.
96 000 cas de
To date,
COVID-19,
over
dont
1,096,000 cases of
ont été
COVID-19,
recensés
including
au Canada. Au
23,500
cours de
deaths
la
have been
dernière
reported in
semaine,
Canada.
en moyenne,
Over the
plus de
past week,
8 600
there
nouveaux
have
cas
been on
en moyenne
average over
ont été signalés
8,600
chaque
new
jour.
cases reported
Au cours
daily.
de la même période,
During the
le
same
nombre de
period,
cas
the
graves
number
et
of
critiques
people
de la
experiencing
maladie
severe and
continue
critical
d'augmenter.
illness continues to
En moyenne,
rise.
plus de 3
On average,
400
over
personnes atteintes de la
3,400 people
COVID-19
with
ont été traitées dans
COVID-19
nos
were being
hôpitaux
treated in our
chaque jour,
hospitals
dont
each day,
presque 1050
including
personnes
almost
étaient traitées dans des
1,050
unités de
people
soins
being treated in
intensifs,
intensive
ce
care
qui
units.
correspond à des
This
augmentations
represents a
de 34%
34%
et de
and
22%
22% increase, respectively.
respectivement par rapport à la
This
semaine
compared to
dernière.
the prior week.
Malheureusement, nous commençons à
Unfortunately, we
observer
are
une
now beginning to
augmentation
see
du
an
nombre de
increase
décès,
in the
la
mortality
moyenne se
trend,
chiffrant à
with an
41
average of
décès au
41
cours de
deaths
la dernière
reported
semaine,
daily over the
soit
past week,
38%
which
de
is
plus que la
38% higher
semaine
than the week prior.
précédente. Nous enregistrons plus
There
de
are over
51 600 cas de
51,600 variant of
préoccupants
concern
à ce jour
cases
au Canada.
reported to date
Le
across
variant
Canada, with the
B117
B117
représentant
variant
presque
accounting for almost
96% des cas.
96% of these.
Durant ces derniers efforts vers l'issue de la crise,
On this
il est
last
possible
stretch
de
through this
retrouver des
crisis, we can
forces
also gain
en
strength
apprenant de
from good
bonnes nouvelles
news
et en
and
nous
focusing on
attardant
the things
aux
we are
choses qui
grateful
suscitent
for.
chez nous un sentiment de reconnaissance. Nous avons été ravis de voir de
We have been
nombreuses
heartened
façons
by
dont
the
les
many
Canadiens
ways
appuient les
Canadians
efforts
are
de
helping to support
vaccination contre la
COVID-19
COVID-19.
vaccination efforts.
Puisque le mois d'avril est le mois
Since
de
April
patrimoine
is
sikh,
Sikh Heritage
nous
Month,
aimerions
we would like
souligner
to
un
highlight an example
exemple dans cette
we
communauté
recently
qui a
learned
récemment
about
été
from
porté
that
à notre
community.
attention. Sukhmeet
Sukhmeet
Sachal, un
Sachal,
étudiant
a
en médecine de
UBC
l'Université
medical
de la
student,
Colombie-Britannique,
has been
collabore
working
avec la Sikh
together
Health
with the
Foundation
Sikh Health
et une équipe
Foundation
de
and a
bénévoles
team of
pour
volunteers
traduire les
to
renseignements
translate
sur la
and share
COVID-19 et
information
les
about
diffuser aux aînés qui
COVID-19
parlent
with
Punjabi dans la
Punjabi-speaking
région
seniors in
sanitaire
the
de
Fraser
Fraser.
Health region.
Ce travail permet d'aider les
Their
membres
efforts
de
are
leur
helping to
communauté
support
à
community
prendre
members
des
to
décisions
make informed
éclairées
decisions
au
on
sujet de la
vaccination
vaccination,
and,
tout en empêchant
at the
les
same time,
mésinformations.
dispelling
Cette
misinformation.
semaine, nous sommes aussi
This week,
reconnaissants
we are also
de faire
grateful to be
partie des 7
amongst the
millions de
over
personnes
7
au
million
Canada
people in
qui ont
Canada
reçu à
who
ce
have
jour la
received a
première dose de
first dose
vaccin
of
contre la
COVID-19 vaccine to
COVID-19.
date.
Or, la bonne nouvelle,
And
c'est que les
the
vaccins
good news is
permettent
that
de réduire
vaccines
le
are
nombre
reducing
de cas
severe
graves de la
illness,
maladie, de
deaths,
décès et
as well as
d'éclosions dans les
outbreaks
milieux
in
et les
high-risk
populations à
settings
risque
and
élevé qui avaient
populations
été
that were
ciblées
targeted in
durant
our
la
initial
première
phase of
campagne de
vaccinations.
vaccination. Mais pourtant, nous devons tous
Though we
continuer
all need to
à
keep
suivre
following
les
public
conseils de
health
santé
advice
publique
and
et à
maintain our
appliquer les mesures de
well-practiced
précaution
precautions
bien
as
ancrées
vaccines
dans
roll out
nos
further,
habitudes, tandis que nous
these
continuons de
benefits
procéder à la
are
vaccination.
building.
Les vaccins
And
continuent de faire effet
they will
et
be the
ceux-ci
bridge
permettront
that takes
d'atteindre le
us
moment
all
où
to
nous serons
greater
en
safety,
sécurité et nous
as
pourrons à
well as
nouveau
back
profiter
to
des
the
choses
things
qui
we
nous
have
ont
missed
tant
so
manqué.
much. Thank
Merci.
you.
Merci, Dr. Nou. On va maintenant passer à la période de
Thank you,
questions, en
Dr. Nu. We'll
commençant
now
par le
move on to
téléphone avec
questions
une
and
question et
answers
une
on the
question suivie.
phone.
We'll then go to the room. Please note that Minister Annan and Dr. Tam will have to leave at 12:30. Opérateur, c'est à vous.
Thank you, merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur l'étoile 1 maintenant pour poser une question. The first question is from Marika Walsh of the Globe and Mail. Please go ahead. Your line is open.
Good morning. Thanks so much for taking our questions. Prime Minister, my question is for you. The Canadian Medical Association is calling on the federal government to change its vaccine allocation and to now start allocating vaccines based on needs in region and not based on per capita. Will your government do that?
Thank you, Marika. These have been conversations we've had ongoing with the provinces over the past many months. Working with the provinces, we arrived at a per capita allocation formula with a carve-out for the northern territories to make sure that they could get rapidly vaccinated because of the level of vulnerability. But of course, we're happy to continue to work with the provinces on adjustings as the provinces see necessary. Depuis les débuts, nous avions travaillé avec les provinces et territoires pour assurer une allocation équitable de vaccins à travers le pays, avec une exception faite pour plus de vaccins pour le Grand Nord où il y a particulièrement de vulnérabilité. Mais évidemment, nous sommes toujours ouverts avec des discussions avec les provinces pour modifier les allocations si ça leur intéresse.
Thank you. So should I take from that you do not personally support changing the current allocation method from per capita? And my next question is on the request from Ontario for 600 critical care staff. Does Canada have that slack in the system that it can send Ontario 600 critical care staff? And if not, are we talking to the U.S.?
We are extremely preoccupied with the situation right now in Ontario, and as I told mayors last night, as I've told my members of Ontario caucus, and as officials have been engaged back and forth with the Ontario government, we are there to help. We look forward to delivering any and all supports that they need. Those conversations are extremely live right now and ongoing. I know there's also been discussions about healthcare resources from other provinces turning towards Ontario. These are all the things that we're working very, very hard on right now to respond to the extremely difficult situation in Ontario. Les conversations continuent évidemment.
We are continuing our discussions, of course. We are very concerned with the situation in Ontario and elsewhere in the country, but particularly through the conversations I've had with MPs from Ontario, with various mayors, and other conversations that are ongoing between our office and Ford's offices. We will be here to help, and we are working to figure out what aid they need. What I can also highlight is that there are discussions with other provinces as well in order to allocate a greater amount of resources to help them in this particularly urgent crisis.
Merci. Next question.
Thank you, merci. La question suivante est de Mélanie Marquis, de La Presse. La parole est à vous.
Merci. Bonjour, M. Trudeau. Je comprends qu'on reçoit les 300 000 premières doses de Johnson & Johnson le 27 avril, selon ce que votre ministre disait. Dans quelle mesure est-ce que le fait que le vaccin est suspendu temporairement aux États-Unis change ou change la stratégie sur le plan d'approvisionnement de son ancien compte?
On continue de s'attendre à recevoir ces doses au fin du mois d'avril et les autres
reception of these doses at the end of April and the other doses thereafter. Of course, we will closely follow all public health advice. We will always base our decisions on expert opinions on the health and safety of Canadians. Perhaps I can turn to Minister Anand to give a bit more information.
Oui, merci beaucoup.
Yes, thank you very much, Prime Minister.
Oui, nous travaillons très fort avec les fournisseurs maintenant
diligently with our providers to bring these J&J doses here in Canada, and that is our priority right now. At the same time,
l'information
We are following
de Santé Canada.
Health Canada information and guidance. As it stands, our government's priority is to have a greater number of doses more rapidly here in Canada. Thank you.
We are focused on receiving as many vaccines as possible, as quickly as possible in this country. We're expecting a delivery of the J&J vaccine at the end of April. Of course, before those vaccines are distributed, we will ensure that Health Canada is continuing to approve this Janssen vaccine for use safely in Canada. We will always put the health of Canadians first and foremost.
Un suivi, Mélanie?
Oui, sur un autre sujet complètement,
On
il y a les
another
conservateurs
matter,
hier qui ont annoncé
some
leur
Conservatives
plan
yesterday
climat.
announced
Il y a une
their
tarification
climate plan.
carbone.
There is a carbon
Voyez-vous
pricing
maintenant,
element in it now. Do you
en
believe?
prévision de la prochaine campagne, avoir un adversaire qui prend les changements
Do you expect
climatiques au sérieux?
an adversary for the next elections that takes the environment seriously? I know that the plan is vast, but could you tell me what you think more specifically about what is being called petropoints by the Liberal Party?
D'abord, les gens attendent depuis longtemps que le Parti conservateur prenne au sérieux les changements climatiques. Malheureusement, ils vont devoir attendre encore longtemps parce que ce qu'ils ont présenté hier, c'est pas un plan. Tout d'abord, ça va rendre ça moins cher de polluer, ça va amener plus de coûts aux familles.
It will increase costs for families, and it will not reduce emissions to the levels that we need.
Ça fait 5 ans qu'on prend les
For the past 5 years, we have taken climate change very seriously. We will continue to be ambitious, but we will also continue to ensure that we help families to move forward in a world that uses less carbon emissions. We have a serious plan. What the Conservatives put forward is simply not serious. It encourages people to spend more for fossil fuels and even reward them for using fossil fuels.
Canadians have been waiting a long time to see the Conservative Party take seriously the fight against climate change. And unfortunately, with what they put forward yesterday, Canadians are going to still wait a long time to see the Conservative Party get serious about climate change. The plan, the approach, the pamphlet, not the plan, that they put forward yesterday actually makes it less expensive to pollute, makes it more expensive for Canadians, and will not fight climate change and reduce emissions nearly enough. With Erin O'Toole's carbon tax, the more you burn, the more you earn. That doesn't make sense to anyone. We're going to stay focused on a real plan that not only is ambitious and stringent against carbon emissions, but supports businesses and families by returning more money to average families across the country, and indeed creates jobs and economic opportunities as we know the world is moving in that direction.
Last question over the phone.
Thank you. Merci. La prochaine question, the next question is from Ryan Tumulty of the National Post. Please go ahead.
Yeah, hi there. Moderna's news that they are cutting their shipment and that they might miss their quarterly target. I know previously they had said that it was a quality control issue. Now they are saying that there's a bit of a supply problem. I'm wondering if your level of trust in this company's ability to deliver is shaky at all.
We have been extremely well served by Pfizer that has been delivering every week 1 million doses of vaccines, and we are seeing that double next month with millions and millions more in the month of June. So that is reliable and will consist of the bulk of the vaccinations that we're going to be giving to Canadians in the coming months. We are concerned about the delays and the production challenges around Moderna, but perhaps I can turn to Minister Anand to speak more directly on Moderna.
Okay, well, thanks, Prime Minister. I think we should go back to our diversified portfolio of vaccines, and we have seen that various suppliers have ramped up at different paces. And Pfizer, as the Prime Minister mentioned, is very reliable in terms of the supply that we are receiving. Moderna is still ramping up, and that is the reason for the reduction in the next shipment, for example. But I do want to emphasize that Moderna did meet its first quarter targets, and it is still possible that we will be on track for our second quarter deliveries. Having said that, we are going to press Moderna going forward to make sure that Canada's voice is known and heard, and that we very much expect them to meet their quarterly delivery targets. We appreciate the difficulties that the company is experiencing, but again, from our government standpoint, we are still seeking to ensure that the quarterly deliveries are there, just as we did in the first quarter of this year. Thank you.
Okay. Nous nous attendons à ce que Moderna atteigne ses objectifs ses promesses pour les livraisons de vaccins au deuxième trimestre, comme ils l'ont fait pour le premier trimestre. On reconnaît à quel point ils font face à des difficultés de production. On est chanceux d'avoir un portfolio diversifié qui nous permet de compter, par exemple, sur Pfizer, qui est en train d'augmenter ses livraisons de façon significative.
Its deliveries in a significant way, but we will continue to work with Moderna in order to ensure that we receive as many doses as rapidly as possible.
Follow-up, Ryan?
Yeah, sir, I'm just wondering too, now that you have these additional Pfizer doses committed, it would seem that you might be able to move up your target vaccinating everyone by September. I'm wondering if you think that's possible, if you think Canadians will be vaccinated earlier than that. Also wondering if you're going to try to do more about vaccine hesitancy now. Certainly, we've seen a lot of that with AstraZeneca, and now that we have a more robust supply, I think that might become more of an issue.
As we pointed out today, we're well on track to reaching in the upper 40 to 50 million doses by the end of June. That means, on the math of it, many or most Canadians will have been able to receive a first dose of the vaccination. That, of course, depends very much on provincial decisions on pacing and on target populations. We know there are a number of Canadians who will get 2 doses, but many others will have gotten their 1 dose by the end of June. That is part of the strategy and the recommendations laid out by our National Advisory Council on Immunization. We're going to continue to try and accelerate doses to Canada, but the one thing we have been firm on and are able to reassure everyone on is that all Canadians who want a vaccine will be able to be vaccinated by the end of September.
Merci. On va maintenant passer aux questions dans la salle.
Oui, bonjour, M. Trudeau, Louis Blouin de Radio-Canada. J'aimerais vous poser une question plus spécifique sur la demande de l'Association médicale canadienne. Tantôt, vous avez dit que vous êtes ouvert à voir pour une réallocation des vaccins en fonction des points chauds, mais pour nous dire spécifiquement où en sont les discussions avec les provinces. Est-ce que vous sentez une ouverture des provinces de peut-être, je ne sais pas, en envoyer en Ontario, par exemple, ou au Québec? Quel genre de réponse vous avez eu? Est-ce que c'est dans vos plans?
On a établi une formule d'allocation équitable de vaccins en discussion avec les provinces. Pour changer cette formule-là, il faudrait que les provinces soient d'accord.
To change this formula, we would have to receive the approval of provinces. We need preliminary discussions. It's a priority for a number of provinces to be able to receive more vaccines, but we know that there have been concerns with regards to COVID throughout the country. So we will continue these discussions.
David?
David Aiken, Global News. Good morning, Prime Minister. I want to talk about the government of Ontario. So just quickly, my understanding is the government of Ontario has not made any request for federal assistance, and that today you're responding with some initiatives possibly at the request of mayors. So I wonder if you could confirm that. And then 2, do you have confidence that the government of Ontario is acting in the best public health interests of its citizens?
Throughout this crisis, every order of government has been doing everything they can to protect Canadians, to help Canadians, to work together. Since the beginning of this pandemic, we've had close to 30 First Ministers meetings in which we have all shared our preoccupations, our concern, our priority, and our desire to work together to make sure that Canadians are kept safe and that we get through this as quickly as possible. There are things that we can and must and have been doing together, and there's always more that we can do together. As a federal government, we have a number of different responsibilities, including procuring and paying for vaccines, but also delivering PPE, providing surge support on contact tracers, on the Canadian Red Cross, even the Canadian Armed Forces. We are there to help, and what we have said repeatedly to all premiers is that we are there to help whatever is necessary. I made a promise to Canadians. I would have Canadians' backs, and that's exactly what I have. We have been discussing closely in an ongoing fashion with the Ontario government, with various officials. We have received a draft request from the Ontario government. We're going to continue to work with them on whatever they need, and we're going to continue to put forward ideas about how we think we can better help. This is a moment where all hands are on deck, and we're all working together to get through this difficult third wave.
Prochaine question.
Bonjour, Boris Proulx du Devoir. On comprend qu'on va voir la couleur des premières doses de Johnson & Johnson pour mai. À quoi les provinces peuvent s'attendre? Est-ce qu'on s'attend à ce que Santé Canada donne son approbation, puisqu'on sait que le vaccin est suspendu aux États-Unis, ou est-ce qu'on peut s'attendre aussi à ce que ce soit réservé à une partie de la population, par exemple AstraZeneca et les 55 ans et plus?
Comme vous savez, Santé Canada a déjà approuvé l'utilisation du vaccin Janssen. Évidemment, on continue de suivre très attentivement la rentrée de données à l'international, sur toutes les différentes doses et vaccins. On est conscient évidemment de la décision des autorités américaines par rapport à Johnson & Johnson. On va continuer de suivre les conseils de Santé Canada, mais je pense que les gens comprennent que on préfère pouvoir avoir l'option de livrer ces doses-là. On va accepter et prendre livraison des 300 000 doses de Johnson & Johnson au fin du mois d'avril. Et à ce moment-là, on va suivre les recommandations les plus à jour de Santé Canada et de notre Comité national sur l'immunisation.
Next question.
Ansay Prime Minister, Christian Ashkatesi, TV National News. Ontario, you've been asked this already, but I want to ask again. Ontario hospitals are in crisis. You have the Canadian Medical Association calling for a national strategy for healthcare workers. When will you step in and start allocating sources to the hotspot areas? You said throughout the pandemic you will offer to help the provinces. ICU numbers are filling up. More and more people are getting sick with this third wave. When will you step in with federal measures? What actions can you take now, Prime Minister?
Every single vaccine dose that arrives in Canada is distributed to the provinces and territories, with a small reserve for federal institutions like corrections, according to a formula that was agreed on by all provinces and territories. It included, for example, a carve-out early on for northern communities and remote communities. It was carefully discussed as the right way forward with the provinces and territories. And in order for us to make adjustments to that formula, we will be working, we would need to work with, as we are right now, with provinces and territories. Right now in this third wave, there are hotspots in different parts of the country, particularly in Ontario, but there are also concerns and caseloads rising right across the country. Throughout this, all premiers have had the same goal: get through COVID-19 as quickly as possible. And we are going to continue to work together with the premiers with all Canadians to make sure that we're doing the right things every step of the way.
Hello, Mr. Trudeau, Mal Hamidi with the Canadian Press. What the argument with your oldest son was about, and what did you say in your explanation that could apply to those feeling the same way across the country who feel that they have done their part but public officials haven't?
Xavier's 13 years old and he misses his friends. He doesn't want to be doing school online. He wants to go outside and play basketball. He wants to, with his friends, he wants to have the normal life that, quite frankly, we all want right now. We want to get back to normal. We want this COVID crisis to be over. We don't want to be told that, no, we're going to have to hunker down for a few more weeks. But the reality is, we know that the best way to get through this is for each of us to follow local public health rules. No matter how frustrated we are, we also know that if we don't, we're putting at risk our summer. We need to flatten the curve in this third wave. And I know in households across the country, parents are having to talk to their kids about restrictions that parents don't particularly feel enthused about either. None of us want to be going through this third wave right now. None of us want to be having to hold back from going outside and enjoying the nice weather and being with our friends and trying to get back to normal as we've been through this incredibly difficult winter. But the fact is, we are in this third wave. It is serious, very serious in Ontario and in some parts of the country, and it could get more serious in other parts of the country. This wave is different from previous waves, in part because the variants of concern are more communicable and more serious. That means the things that we did before might not protect us the same ways. That's why listening to public health advice, following the rules, and hanging in there for a few more weeks, maybe a couple more months, is going to be the way we can get to a summer that is as close to normal as we could hope for. I know we're all frustrated, but we will get through this as long as we give it one last push.
Thank you, Prime Minister. Last question before you have to leave.
Thanks. Hi, Rafi Bujukan, CBC News. Prime Minister, we're hearing from Quebec just now that this weekend trucks with megaphones are going to drive around certain neighborhoods to tell people to get lined up for AstraZeneca shots, especially with the Moderna delay. What do you view as your role in convincing other public health authorities and Canadians that AstraZeneca is safe, especially for cohorts under 55? Thanks.
Obviously, we will every step of the way follow the best advice of medical professionals and health experts. Health Canada has reconfirmed that the AstraZeneca vaccine is safe for use. There are side effects, but they are so rare that it is much safer for people to get vaccinated with whatever vaccine is offered to them than to go unvaccinated, particularly in this third wave. We will continue to emphasize and put forward those recommendations. And of course, like always, we will turn to doctors to emphasize that, which I'm happy to do right now by turning to Dr. Tam.
It's Dr. New.
Dr. New, that's right. Dr. Tam had to leave. Go ahead. Go ahead, Howard.
So what specific question and point? Sorry, I just wanted to make sure I'm answering the right part.
It was on encouraging people to get vaccinated, including with the AstraZeneca vaccine, which Health Canada has reconfirmed is safe.
I think we've repeated it many times, not just Dr. Tam, myself, but I think experts and public health authorities across the country. You know, all of the approved vaccines by Health Canada are very safe and effective. I think the proof is in the pudding, as they say. Millions of doses of the AstraZeneca vaccine have been administered around the world, and this rare event is exactly that. It's very rare. Look in Canada, we've had, I think, the one reported case in Quebec, And as I mentioned yesterday at my technical briefing on vaccines, we've actually administered over 700,000 doses, 709,000 doses to be exact. And I'm sure the number is increasing. So that gives you an idea of the sort of rarity of this event. And the fact also is that we can treat this event. Physicians are now getting sort of information and education about how to quickly detect this very rare side event and how to appropriately treat it. And this individual who had the rare side event is recovering. But having said that, look at the 700, almost 710,000 doses that were administered. All those people now have a level of protection against COVID-19 that they didn't have before. So I think I'll just leave it at that. I'm not sure what more we can say. We've been keep repeating the same thing. So there you go. Thank you.
Thank you, Dr. New. Merci, Monsieur le Premier ministre.
Merci tout le monde.
On va donc retourner au téléphone pour des questions pour Dr. New ou pour le ministre Leblanc.
Dr. New or Minister Leblanc?
Opérateur?
Oui, thank you, merci. And so please press star 1 if you have a question. Veuillez appuyer sur étoile 1 si vous avez une question. The first question. La première question est de Lina Dib de la presse canadienne.
Lina Dib, presse canadienne. Question.
Lina, tu es peut-être sur mute.
You might be muted, Lina.
On peut peut-être passer à la prochaine question.
Perhaps we'll move on to the next question.
Ah oui, Lina, on t'entend.
Oui.
Lina, go ahead. Question.
Alors, je ne pensais pas que j'avais un mute sur mon vieux téléphone.
I didn't know that there was a mute option on my old phone.
Ma question était pour Dr.
My
New,
question is for Dr. New.
de la Formule 1, le Grand Prix à Montréal. Je veux savoir si vous considérez une exception pour les quarantaines pour que
quarantine exceptions so that the Montreal Formula 1 race can happen, the Grand Prix,
ou est-ce qu'il n'en est pas question
or
du tout?
will they still have to quarantine?
OK, merci pour la question.
Thank you for the question.
Première chose, je peux dire que je suis toujours un fan de sport. J'adore la Formule 1.
I love Formula 1.
Encore des exploits de Gilles et aussi Jacques
Villeneuve's exploits in the past,
Lewis Hamilton.
and Lewis Hamilton,
comme un fan
and
de
his
sport,
exploits
j'aimerais
today.
aussi, c'est comme beaucoup de
Fan
Canadiens,
sports, and
mais
like many
on est en
Canadians, that
train
is the case, but
de
we
gérer
are
une pandémie
currently
aussi avec
managing
une
a
troisième vague ici au
pandemic. We are in a third wave here in Canada, so this is also something very important to highlight. Usually,
la perspective de la santé publique,
with regards to public health,
une bonne collaboration,
we need a good
coordination des
collaboration and
ici,
coordination
à
at every
l'échelle
level.
fédérale,
At the
on
federal
attend
level,
toujours s'il y a une proposition pour
we are waiting
peut-être
to see if there is a proposal
ou un événement
to perhaps organize an event
qu'est-ce qui peut-être aura lieu
to
ici au
see
Canada,
what will be able to be done here in
les
Canada.
lettres de
We could
support
perhaps have
de l'échelle
support
de la
letters
santé publique
from public
locale
health
et aussi à l'échelle provinciale.
at the
Parce
federal
que c'est
and provincial
important
level,
qu'eux, ils ont aussi un niveau
because
de confort, d'être
they should feel
confiants
comfortable
avec la
and
proposition aussi des
confident with the
protocoles
proposal
pour le
of
dépistage, tout
having
ça, la
certain
quarantaine, que
testing protocols and quarantine
les
protocols for
organisateurs pour
sporting
l'événement
events.
ont soumis. Ici, dans le cas, est-ce que je peux aussi dire que moi, je vois que c'est très important de respecter la perspective de l'échelle locale parce que c'est eux les autorités de la santé publique à l'échelle locale qui est vraiment sur le terrain, qui connaissent mieux la situation, l'épidémiologie, c'est quoi même les enjeux avec les systèmes de soins de santé ici dans le cas de Montréal. Donc, nous autres, à l'échelle fédérale, on attend toujours s'il y a une proposition, on attend toujours, comment dire, les lettres de support de l'échelle locale et aussi provinciale avant que nous autres, on commence aussi à faire notre analyse. Et on est en train encore d'attendre les lettres de support, mais jusqu'à date, on n'a pas reçu des lettres.
Merci, Dr. New. Un suivi,
Lina? Follow-up, Lina?
Oui, donc si j'ai bien compris,
So
Dr. New, vous dites que vous n'avez reçu aucune demande qui a rapport au Grand Prix
with regards to
de Montréal. Est-ce que
the Montreal Grand Prix. Is
Et
that what you're saying?
avant de répondre, j'ai une...
Before you answer,
parce qu'après ça, on va me couper. Et j'ai une autre question, celle-là pour M. Leblanc, c'est au sujet
Minister
du budget
Leblanc
qu'on
with
attend
regards to the
lundi.
budget.
M. Leblanc, il y avait un...
Minister Leblanc.
très bonne chronique ce matin signée par Hélène Buzetti dans un journal qui rappelle que le directeur parlementaire du budget estime qu'un plan de relance de 70 à 100 milliards de dollars pour 3 ans, ce serait trop tard. Déjà, juste un peu d'aide à la première année avec toutes les économies que les gens se font depuis un an parce qu'ils ne s'achètent rien. Ce serait suffisant pour relancer l'économie. Ce que je voudrais savoir, c'est votre gouvernement est en train de prendre en considération ces conseils du directeur parlementaire du budget, s'il a oui ou non l'intention de maintenir sa promesse de 70 à 100 milliards de dollars de relance sur 3 ans, si vous ne tenez pas compte des conseils du directeur parlementaire du budget, pourquoi pas?
Into account the PBO's recommendations, then why?
So, Dr. Yes,
go ahead, Dr. Please.
Okay.
I will begin.
Okay, pour finir la question.
So just to conclude the question with regards to the Montreal Grand Prix,
on est au courant parce que
we are aware of the
on est toujours en
situation.
bonne communication avec
In constant
l'échelle
communication
provinciale. C'est normal pour nous
province.
autres ici, le gouvernement fédéral, on a des bonnes communications avec l'échelle
good levels
provinciale.
of communication with the provincial governments.
C'est l'échelle provinciale qui a reçu la proposition de Formule 1.
It is the province that received the Formula One request, and they let us know that they were in discussions. But as I already explained, at the federal level, we are waiting for support letters before moving forward, and we're allowing public health authorities at the provincial level to make a decision, as well as the Montreal Health Authority. We will allow them to have their own discussions within the province and a municipality before we move forward. We're waiting for their support letters. As it stands, we have yet to receive a support letter from the local and provincial levels. Does that answer your question?
Et peut-être, Lina, sur la question du programme de stimulus économique, évidemment, on est toujours intéressé à voir les opinions du directeur parlementaire du budget, sa recherche, les services en termes de politique publique sont importants et font évidemment partie des décisions que la ministre des Finances prendra, que le Conseil des ministres considère. Nous avons cependant annoncé l'intention d'un programme de stimulus économique chiffré sur un pourcentage du produit brut du Canada, beaucoup en lien avec ce que d'autres pays, par exemple en Europe, ont fait. Et c'était aussi des recommandations de d'autres économistes et académiques à travers le Canada et à travers le monde en ce qui a trait aux autres économies et le besoin d'offrir un stimulus après COVID. Vous savez, l'impact économique de la récession qu'on vit présentement est différent que d'autres récessions dans le passé. Il y a certains secteurs qui ont été évidemment très durement touchés. On pense beaucoup à l'industrie du tourisme, des arts et de la culture, les arts de la scène, la question de voyage, les restaurants, tout le secteur de l'hospitalité. Alors, la ministre des Finances, la bonne nouvelle, c'est que la ministre des Finances
and the good news is that the Minister of Finance will have a lot more to say
juste dans 3 jours,
in
lundi qui
just 3 days, actually, this coming Monday. I believe that Canadians will be happy with the direction taken by the government to support them during this economic recovery.
Beaucoup. On va prendre une dernière question au téléphone,
question on the phone, operator.
Merci, thank you. La dernière question, the last question is from Cormac McSweeney, City News. Please go ahead.
This next question is for Minister LeBlanc. Minister LeBlanc, Ontario, just moments ago, has announced that it is turning down the federal offer of Red Cross help with vaccination efforts, saying the problem here is supply of vaccines, not the capacity of the province to deliver those vaccines. If I can just get your reaction to Ontario turning down this offer, and then as well, will this rejection affect any of the other help that the feds are offering Ontario?
Obviously, the Prime Minister said a few moments ago, and we have said from the beginning of the pandemic, that the Government of Canada will always be present to do whatever we can to support provinces and territories as we all go through together these very difficult weeks and months of the past year. So obviously, if the Ontario government has specific requests that the Government of Canada can fulfill, we will move expeditiously to say yes to requests that we get from the Ontario government. With respect to the supply of vaccines, obviously we share the impatience of all Canadians to receive a vaccine as quickly as is possible. And that's why, for example, the good news that the Prime Minister shared around additional Pfizer doses coming sooner than we had expected even a few weeks ago, let alone a few months ago. All of this is part of our continuing effort to get as many vaccines into Canada as quickly as we possibly can from different sources around the world to build in those redundancies. And we'll continue to do that because, like Premier Ford and like all Canadians, we understand the urgency and the benefit of vaccinating as many people as quickly as possible. That's why it's such a huge priority for the government.
And just as a follow-up, Minister, can you clarify whether Ontario asked for vaccination help in the draft letter that it sent to the federal government? But then also on top of that, travel restrictions between provinces. What conversations are you having with premiers right now? And is the federal government going to be involved in any way at all in helping with travel restrictions between provinces? Or are you largely just going to leave that up to the individual provincial governments?
So with respect to the possible request for assistance that comes from the Government of Ontario or any other provincial or territorial government, as you know, these are formal requests under a formula that's existed for many, many years that are sent to my colleague, the Minister of Public Safety, Bill Blair. And obviously, the government's decision from the very beginning is to move as quickly as possible to say yes to all of these requests as soon as we get them. Sometimes officials share potential drafts of what a request for assistance might ultimately be in order to help Canada, the federal government, better prepare to say yes and move as quickly as we possibly can. So there are often ongoing conversations between officials, and obviously we remain open 24 hours a day, 7 days a week to any of these requests from any provincial government. I talk to different provincial ministers and provincial premiers from time to time. And this is an ongoing collaborative conversation. With respect to travel between provinces and territories, those are properly decisions that provincial governments make. The Prime Minister, my colleagues have referred to, for example, decisions that the Atlantic premiers took to create a bubble where you could travel between the 4 Atlantic provinces. But right now, as I speak to you from Moncton, New Brunswick, I am not able to go to Nova Scotia without having quarantine obligations imposed on me. And the same thing would be true somebody coming to New Brunswick. So provinces from time to time, based on the public health advice of their public health officials, make these decisions. They're properly within provincial jurisdiction. If other provinces want to enact other measures at their borders with respect to travel between provinces, they're obviously free to do so. The Government of Canada is there, again, to support these decisions, not to substitute our decisions for the decisions of provinces. That wouldn't be the way to proceed. But obviously, if provincial officials ask for help, if it's research assistance, if it's public health information, or ultimately if they ask for specific help around enforcing certain measures, obviously, again, back to your previous question, we're more than happy to do whatever we can for as long as we can, and that's the position the Government of Canada has taken, but it really is in support of provincial decisions with respect to interprovincial travel.
All right, we're just going to go quickly before wrapping up 2 quick questions in the room.
Great. I'll keep Minister LeBlanc sort of on the same topic. The Prime Minister speaks with 3 premiers, your former caucus colleague, Bonnie Crombie, your former Commons colleague, Patrick Brown, and I'm certain Mayor Crombie would have told the Prime Minister, I don't know if you heard the call, that she's running out of ICU spaces. She doesn't have healthcare workers. So I wonder if you're talking to Premier Ford to say, no, really, Premier, you really do need our help. He doesn't seem to want to ask for it. I wonder if your current Ontario caucus colleagues are saying, please, get Ford to ask for help because Ontario needs it.
Well, obviously, my caucus colleagues from Ontario, my cabinet colleagues from Ontario, talk frequently to me and to other ministers about the circumstances in Ontario. Our COVID cabinet committee discusses as recently as 2 or 3 days ago. We're looking at having another meeting this weekend in order to ensure we have the latest information in terms of what's happening across the country, and obviously with a deep concern for what's happening in Ontario. But the way the system works, the province of Ontario has the insight as to what their particular needs are. And at any time they think that the government of Canada can be supportive or can offer assistance, we're happy to do so. We're happy to provide that assistance. It's not helpful for us to preempt provincial decisions around what is the specific needs they have. I know that there are conversations, for example, just to use another example, I spoke with the Premier of Newfoundland and Labrador today, Premier Fury, who is looking at whether there are Newfoundlanders who would volunteer, public health professionals who could volunteer to go to Ontario and perhaps support some of the specific needs that health authorities in Ontario have. So provinces amongst themselves are obviously looking at what they can do. I said to Premier Fury, for example, if he's able to have a group of volunteers that would go and fulfill a particular need that he identifies with the Ontario government, perhaps the armed forces could provide transportation for those people to go to Ontario. So these are exactly the kind of ongoing conversations that happen multiple times a day. And obviously, we'll continue to be open to do whatever we can as quickly as we can.
Thanks, Minister. My follow-up is for Dr. New, a science question, Dr. New, from one of my colleagues. We've taken note, of course, that whenever we see some adverse effects with either the AstraZeneca or in other countries with the J&J, there seems to be a pretty distinct gender imbalance. It's women who seem to be experiencing some of these side effects. I wonder if you have any science on why that is, why it is women rather than men who typically are experiencing these side effects, and what conclusions we might draw from that.
Well, thank you very much for the question. What I would challenge the premise to the point that my understanding, and I'm not the regulator, certainly Health Canada has been looking very carefully at all of the data that has been provided both by the manufacturer, because they did impose new terms and conditions on AstraZeneca, as well as looking at the data that was presented in other fora, for example, the European Medicines Agency. And my understanding is to date, based on the fact that it's such a small number, if you're looking at, quote, stratification by age and gender, there's not enough, information, data, or evidence to really indicate that a specific group is at higher risk. So I think it's still an evolving situation. We'll all continue to look at the data, including, obviously, as you say, it's a very live issue right now in the United States. I understand that their, quote, NACI equivalent, which is, I think, the Advisory Committee for Immunization Practices in the U.S. is looking carefully at the information data as well to see if they could or should be making any recommendations with respect to sort of the public health sort of rollout of the vaccines. But at this point, I think it's still a live issue, and there's no evidence that I'm aware of that really would lead us to say that it could or should be really, from a, like you say, gender perspective, be aimed at restricting its use in that sense. But having said that, science continues to evolve, evidence continues to accumulate. As to be honest, as we're rolling out the vaccines, as millions of these doses of vaccines are being administered around the world, we're getting more and more information in terms of real world, what we call effectiveness of these vaccines. Thank you.
Dernière question.
Bonjour, question pour le ministre Leblanc, Louis Blouin de Radio-Canada. Écoutez, j'aimerais vous entendre sur l'idée avancée par l'Association médicale canadienne, à savoir, là, il faut commencer à réallouer des vaccins en fonction des points chauds au Canada, il faut déplacer des ressources médicales. À un moment donné, est-ce que le gouvernement fédéral n'a pas une responsabilité de s'investir, d'intervenir et de dire, là, écoutez, il y a une situation très sérieuse, par exemple, en Ontario en ce moment, et il faut rediriger
and we have to redirect doses to the province. Is there a certain level after which the federal government will finally decide to step in?
Je pense que le Premier ministre a bien
I believe that the
expliqué
Prime Minister very well explained the vaccine sharing formula that is used. This formula was proposed by the federal government in December 2020. Or rather, it's the provinces that proposed this to the federal government. So the current sharing formula is the formula put forward by the collective efforts of provincial premiers. They made the request. That being said, we were concerned to hear the circumstances in a number of regions in our country, but the fact remains that any discussion with regards to changing this vaccine sharing formula will have to begin with a consensus between premiers at the provincial level, and I know that this kind of conversation is currently underway, but I don't believe that we are on the cusp of receiving a consensus from provincial premiers throughout the country to change the sharing formula that is used, and that was accepted by all premiers and that was proposed by premiers last December.
Vous avez un outil qui s'appelle la loi sur les mesures d'urgence qui vous
a tool,
permettrait de
the
réallouer
Emergency
des
Measures
doses,
Act,
qui
that
vous
would allow you
permettrait de
to
réallouer des
reassign
ressources.
resources
Est-ce que
and
pour vous,
doses.
la porte
Do you
est
believe
fermée
that the door
pour
is
l'utilisation
closed
de la loi
to
sur
the
les mesures
use of the
d'urgence?
emergency
Oui ou non?
measures through the Emergency Measures
on peut
Act?
prendre beaucoup de mesures sans avoir recours
We can undertake many
à la loi
measures
sur
without
les
turning to the
mesures
Emergency
d'urgence.
Measures Act.
Le Conseil des ministres, le gouvernement n'est pas du tout
government's
en train de
cabinet
considérer
isn't
cette
considering
question-là pour le
this
moment.
kind of
Et d'ailleurs, les
eventuality
premiers
right
ministres ne
now.
nous ont pas demandé
And
non
premiers
plus
have also not asked
d'invoquer
us to
cette mesure
invoke
juridique-là.
this legal
Merci beaucoup tout le
tool.
monde. Ça met fin à la conférence de presse.
Merci. Bonne journée. Have a good weekend, Howard.
Yeah, you too, Minister.